COVID-19 is a disease that is caused by a virus called coronavirus. The name COVID-19 itself means coronavirus disease 2019 because it was discovered in December in 2019. The disease was first discovered in a city called Wuhan in China. The COVID-19 virus is a new one, meaning that it is the first time it is being seen, and this is the first time it is causing disease in human beings. It is a virus that is said to be seen in bats and now has been able to transmit its disease into human beings. The disease is basically one that affects the respiratory system. It basically goes to affect the lungs. The most common symptoms that the COVID-19 is associated with are cough, sore throat, difficulty in breathing. These are the three commonest symptoms that patients with coronavirus have. But you also have other symptoms that include loose watery stools, fever. Fever is also a very important symptom. Sometimes you have loss of appetite and then change, or you are not able to smell anymore, and then body weakness and body aches. People come up with different symptoms. But in 80% of cases, the disease takes a mild or moderate course. But in the remaining 20%, you can have severe symptoms, and ultimately, in a very small percentage, leads to respiratory distress or difficulty that can eventually lead to death. People who are affected by this virus can have it on their hands, and when they touch any surfaces, these viruses are transmitted to these surfaces, especially things like door handles, tables, any household surfaces that are being touched by the infected person can leave the viruses there. So an individual who is not infected comes in contact with those surfaces that have that virus, can now get infected by the virus. So now the disease, like I said earlier, runs a very mild or moderate course in majority of patients who are infected. However, there are a group of patients who are more susceptible to the severe forms of the disease. This includes the elderly, young children, and also people who have comorbid conditions. When we say comorbid conditions, we mean people who have some other illnesses, most especially people who have diabetes, asthma, people who have cancer, and people who have diseases that cause their immunity to be reduced, such as people with kidney diseases and HIV. Now, for this group of patients, when and if they do get the infection, the severity, the course of the disease is very severe in them, and they're the ones that are likely to have the severe forms that can lead to death. Now, the major strategies that are involved in preventing COVID-19 are about 3 or 4 major ones. The first one is hand washing constantly. And this hand washing should be done with soap and water, any kind of soap, whatever soap it is, as long as it lathers and it foams. You use it to wash your hands regularly. Hand washing should occur for at least 20 seconds. The second thing is to practice etiquette when coughing and sneezing. It is recommended that a person who has cough or sneezes should use a tissue rather than use his or her hands to stop the droplets from going out. So when you cough and you sneeze, the tissue should go across your face and your nose and your mouth, and you cough or sneeze within that tissue and immediately throw it away. Do not reuse that tissue, and you go and wash your hands. Now, in the absence of soap and water, you can use a hand sanitizer which contains about 60% of alcohol. Now, the other thing you can do is, if you don't have tissue, to cough or sneeze in your elbow. So for example, you are going to cough or sneeze, you cough because that way you do not get the virus into your hands. Now, if I'm wearing a short-sleeved dress and it is my skin that is out, then I should cough in my shoulder, like this. That's the case for etiquette for coughing and sneezing. The third thing is social distancing. This is a term that is used in public health to say, to show how people need to stay away from each other, and so you need to stay at least 2 meters away from each other. And that is what it's called social distancing. This is a summary of what the COVID-19 infection is. At least in our lifetime, in my lifetime, there has never been anything like this with this kind of magnitude. 20th of April, it has affected over 2 million people. Over 150,000 people have lost their lives. Here in Nigeria, the cases are increasing. The best way in which this disease can be dealt with is by us taking responsibility, because COVID-19 for now does not have a cure. The hope for it is for us to develop a vaccine and so that everybody can be vaccinated. However, there is no vaccine present right now, and it's going to take at least 18 months for a new vaccine against COVID-19 to be developed. So the responsibility is on all of us to protect ourselves and our families. The governments around the world have all come out together with the WHO on recommendations on what we all need to do. Please take responsibility. We all need to stay in our houses, because when we stay in our houses, the virus does not have a host to fall into to continue to infect people. Please protect yourself, your families, and your communities at large. The virus is real and it is fast spreading. So please be the responsible citizen that you are and obey the recommendations that have been given. Thank you for listening.